Check, check, 1, 2. Welcome, everybody, to another HouseCall VR event. I'm Oculos410, and we are here in the amazing HouseCall VR Auditorium. We've got a special guest today who's going to be talking all about more amazing things in this medical metaverse. So all you got to do is stay tuned. If you got questions, feel free to drop them down in the comments below. We've got lots of time for you to drop those comments, but we want to make sure that we get all your questions in early. That way, when it's time for the Q&A, we'll be able to toss those in the auditorium live. Now, if you're in VR, join us in VR. We would love to have you in Horizon World. So join us. We're in the HouseCall VR Auditorium, and you could find us in the events section. Otherwise, join the world, and you'll see the event live right in your menu. So for now, let's go ahead and toss it over to our guest speaker. Please welcome Dr. Bilge Gregory.
Hi, everybody. Thank you. I'm Dr. Bilge Gregory, and I'm really proud to have been invited to this event. Thank you so much. It's really exciting. It's groundbreaking, and I love being a trailblazer in so many ways. So thanks again. So I want to start out with a question. It's kind of rhetorical, but have you ever been invited to be in a photograph and decided that you weren't comfortable with anything below your chest being shared? So you either stood behind somebody or an object in order to hide some body parts? That is definitely something I want to help solve. So that's why I'm here. I am a practitioner and expert in a high definition liposuction procedure called fun sculpting. So liposuction is a really interesting technology that's really only been around since the 80s. And what I like about this particular technology is it's really pretty new. It's been around probably over the last decade. It was created in Germany. And classic liposuction is what most people know. And that was the one that was invented in the 80s. That's more essentially an extraction with a cannula on a stick with no real exciting technology associated with it, which is why if you may have seen videos, you probably haven't been too interested in watching things like that. They can be a little aggressive, right? So the point about that is that this is a very gentle procedure. This type of liposuction is the only kind that will not rip, cut, tear, heat, or freeze tissue. So that means for people, less downtime, less bruising, and less discomfort, really. So I want to talk a little bit more about what sorts of people might be good candidates for this type of procedure. A lot wider than you would think, and that's what I love about it. Is a lot of patients are not good candidates for classic liposuction. And if I have not mentioned this already, classic liposuction is offered in about 80% of facilities in this country. So clearly, it wouldn't be unlikely that if you went for a consultation specifically for that procedure, that you might be told that you're not a candidate. So you might be offered a different type of procedure, maybe something that was more invasive. Examples would be a tummy tuck or a bra lift. And maybe you're not interested in something that's that extensive with that kind of downtime or discomfort, right? So that is why people are interested in a procedure like liposuction, because problem areas are what, honestly, I would say the large majority of adults deal with, okay? Regardless of their level of fitness, a lot of people deal with problem areas. Let's talk about some. Love handles. Men and women deal with problem areas like love handles a lot, even when they're fit. And another example would be, and perhaps more women than men, I call them saddlebags. You could also just call them large outer hip area, right? So those I'm just going to give examples of. No matter what level of exercise or diet you might impose on yourself, they will grow smaller or larger, but they will never go away. And that's just because it's the pattern with which your body has created the fat. That's something you grew up with. And then, of course, the fat pattern changes when your hormones change. And especially, of course, in women, I could say I probably have 3 or 4 different bodies in my life, right? Very like the child body, then the pubertal body, perhaps, and then the pre-child body in my 20s, and then the post-child body in my 30s. et cetera, et cetera. So definitely the pattern where my fat was deposited has changed over the years. And I'm not saying it's not possible for men too. I'd say some men even have dealt with things where they never had an issue with, let's say, the donut around their umbilical area. And then as they got older, maybe in their 40s, despite the fact that they were diligent exercisers and had paid good attention to their diets, that donut wouldn't go away. So that is something that would really be somewhere I can come in and help out with. So going back to this type of procedure, a lot of people are concerned about the downtime about that. Downtime in this particular procedure is pretty exciting. It's because our access points, or the where I go into the body, are very, very small, that there's no stitches involved. So that's pretty great, which means that other than maybe some fluid being infused to get you numb, which we would like you to work on through exercise and lymphatic drainage with post-op therapy, we still love that you stay active soon after your procedure. So that means downtime is pretty small. I've actually done the procedure on a Friday and the patient was back to work on a Monday, which is quite exciting. In fact, I'm just going to throw him out there. My husband is a firefighter and he actually underwent the procedure. His problem areas were exactly where I described before. And at a certain age, it was like even a few pounds made a difference as to whether those problem areas got worse, right? So then you become obsessed with how much you weigh, like, oh, I'm 3 pounds heavier than last week. And look, this body part problem area is bothering me even more today, right? Water retention might be a reason. So once he had that addressed as a firefighter, he was able to get back on shift within 5 days. And when I say shift, you can imagine like he's got a pretty labor intensive job, but he was able to do so. So that's pretty cool too, that you don't have to put away your work life for 3 weeks like you might have experienced if you had a tummy tuck, for instance, and not be able to drive. There's a lot of limitations on that particular type of procedure. So again, going back, what I love about this as compared to classic or old school liposuction is that, like I said, the downtime is less, and there's areas that are considered not as good of candidates for classic, but you are a candidate when it comes to fun sculpting. I'll give a great example. What do you call it when an abdomen kind of flops over? I call it the flop, but the medical term would be a pannus, for instance, right? So I'm sure what you guys might guess is that a lot of doctors, if a patient goes to consultation for a flop, would tell them that the only option would be a tummy tuck. And the exciting thing is that that's not the case in my scenario with fun sculpting. I have taken care of patients who've had excessive abdominal fat, which caused the skin to fold over in the pelvic bone area. And then that causes, laxity of skin, etc. But believe it or not, because this is a gentler type of liposuction, and the reason it is because it uses vibration, it tends to preserve the subcutaneous tissue. And so if the skin is sticking to the muscle with what we call subcutaneous tissue, I would say it's kind of like a rubber band. If it's gently removed, if the fat is gently removed, and then the abdomen is compressed. Does somebody have a question? Okay. No worries. So anyways, if the fat is being removed and then you compress it, the skin actually tightens on its own because now the weight of the fat has been removed and the connective tissue hasn't been cut or ripped or damaged in any way. It's the elasticity of it is much more surprising than you would think. I'm really excited. If you do look at some of my examples on my social media, you can see patients who've clearly had a larger amount of abdominal fat who probably would have gone to a number of doctors for assistance and would have been told that their only option would be a very extensive procedure like a tummy tuck. So, going back to that, those patients might come in, and maybe I would say that those patients would benefit from more than one round of liposuction in order to be able to extract the maximum amount and then let the skin really go back as much as possible. So, but that would be probably in that extreme case. I've also taken care of people who are on the much leaner side. In fact, a fitness competitor at some point came for help, and mainly because she, no matter what she did, and I'm sure she had access to a tremendous amount of information, yet with her practices was still having difficulty with literally the circle of donut of fat around her umbilical region, and it was affecting her competition results. And I don't suppose, she'd actually told me that one of her coaches mentioned considering a type of procedure like this, because clearly she wouldn't need a significant amount of help, and it would just literally address that one small problem, and it might help her with her competition results. So she came with I think it was maybe 10 or 11% body fat. Obviously that's quite lean, maybe less, to be honest. And when we addressed that area, it completely flattened, and the example is on my social media. It's a pretty nice appearance. And it really did. She was actually starting to win more fitness competitions because literally her problem area was gone, and she was able to address everything else with how she had been doing previously. So let's talk a little bit about fat. A lot of people don't know that you don't make fat as an adult. You do not make fat cells. You expand and contract them with your weight changes. It means also that fat is only created during the childhood years, and I believe it doesn't go much beyond the ages of around 7 or 8, which also means childhood obesity is a huge problem, because let's say a 5-year-old had up 5 million fat cells. Let's just throw that out there. And they were average size and weight for their age, yet an obese child, let's say, had 20 million fat cells because of their body habitus. That's something they'll have to fight with for the rest of their lives. So the number of fat cells remains stagnant after a certain age. The upside to that is that if you have liposuction, or if you have a fat reducing procedure surgically, then you're actually getting rid of fat cells you will never regain. So I tell people, I make your shape and you create your size. So that also means that you wouldn't ruin your liposuction, meaning, let's say you gained weight after you had it. I have done that. I'm a person. I've had liposuction, and I've also gained weight after one of the procedures, and it was like the heaviest I've ever been as an adult without having been pregnant. Yet my body shape was the same, because I didn't have that fat was extracted from, let's say, my sides. And so I didn't grow love handles, or it didn't create, a different shape. I was just a larger version of me, and it kind of went everywhere, but more so to the areas that didn't liposuction, basically. So that's just something to note. So people might want to know what areas can be treated. Cool. Okay. So start with the chin, and it goes down from there. So chin and anterior neck area, and then you go down to some women deal with fat in the anterior axilla or armpit area. That's an area that certainly can't be treated with exercise and diet. It's really hard to get rid of fat right in that area. Arms themselves, definitely. Bra line, and for a man, the chest wall can also be a problem in the lateral chest wall, towards the back especially. Then the male chest wall, there's also a condition called gynecomastia, but there's 2 types. One where there's glandular enlargement, and then this other kind is when it's fat. Okay, it's simply fat, and the glands are not the problem. That can be assessed in consultation, because it's difficult for a typical patient to know which of the 2 they're dealing with. So comfortably so, they might ask, hey, do you treat patients with gynecomastia? And I say, yeah, half of them. So yeah, I make sure that in consultation we address whether it's from a gland enlargement or if it's the actual fatty tissue. But certainly when it's fatty tissue, that can be extracted, and the males like to have more of the masculine looking chest, a lot of them. So of course that's a really nice, and it enhances their pectoralis muscles, which I think they really like. And then, of course, the abdomen is the favorite for everybody. But what I love are the love handles. I feel like you can make the biggest difference in somebody's body silhouette when you address the love handles. Seriously. Because as much as you can kind of flatten your tummy with some Spanx and tighter leggings and tummy, what are they called? It's really hard to get those love handles, that hourglass in the female, for instance, or the male just getting rid of the bulge on the sides. With clothing, right? And then it bulges over your clothes. And I think that causes a lot of self-consciousness in some people, right? Some self-sabotage when they look in the mirror or think about it. So anyways, I think you can create the best changes with the smallest area. It's pretty cool. And it also changes how you look from the backside. If you're just looking from the rear view, for the female, it helps because sometimes patients have dislike of their buttocks, like the shape of the buttocks. Maybe they might say it's too squared off, or my hips are too. If you create a curve in that area, so a woman should have two curves. It should start with her shoulders is the one major curve, and the second should be around her hips, and then the ideal would be like the hourglass, so that they are leaned in here, right? So if the hip love handle area is addressed, then you're actually changing the silhouette of the buttocks too, because all of that fatty tissue that was right on top is now gone. So now you really are seeing more of the gluteal area and the hips. I think that looks really beautiful. In the males, yes, in the hourglass, the females, but in the males, I love because it creates that triangle back, right? So the shoulders are typically more broad in a male, and when you get rid of the love handle, it looks so good. I mean, they look so fit, and then you can, a lot of times in a lot of men, well, actually women too, we all have a six-pack. Did you know that? We all have a six-pack, but it's hidden underneath some layers, right? So that's what's cool too, is when I can take care of patients who are a little on the leaner side, but maybe they just have a little layer of fat. Oh, as soon as we do a sculpting procedure on them, you can see their six-pack. It's beautiful. It's really lovely. So I love doing that. Another area that not a lot of doctors do, because the complication rate is a little higher, but I love doing it because it was one of my problem areas and I want to be able to offer to others. So I really worked hard on excelling in this area, is the outer thighs. Typically not a male issue, more often a female issue. But outer thighs, lower hips area can be actually very much affect the clothing you wear too. You know, how you feel in the clothing and how it shapes you, like the round or out pointy even. Some people have more of like the cone shape in that area, which they make them very uncomfortable. So the reason the complication rate is high there is, I suppose, if you took your hand and grabbed at your tummy and hey, how are you? Welcome. I suppose if you took one of your hands and grabbed at your tummy, you can feel the fat pattern there. That's a little bit more of like a pocket, right? It's like a sack with some fat. But if you grab, even not so much men, like I said, women have more fat in that area. If you grab the outer thigh, it's more spongy. It's more spongy. So it's like almost like fat is nestled inside more connective tissue, spongy connective tissue. And so what I mean by complication is, if you over liposuction an area like that, you can create a divot or a crater. And so that's why a lot of surgeons tend not to work on those areas, because it's not hard to do, believe it or not. I have like a special way of doing it, meaning the way I position the patient such that I can see in real time how much I'm removing. And so I'll know how much to flatten. It's not so good to take care of them when they're just laying on their side on the bed, horizontal. That's where the problems happen. So you either, excuse me, undertreat or overtreat when that happens, right? Because if you're nervous to make the divot, then you've left more than they wanted. And then if you're trying to be aggressive and get rid of it, sometimes you can do too much, right? So outer thighs and inner thighs, definitely. Knee area is a very interesting one in the between the knees and the medial aspect, but the lateral aspect can happen too. And some people have issues with the what we call proximal calf, or the calf just about portion of that where it's supposed to narrow in just below the knee. That area can be an issue, but also the ankle or the cankle area is the last area that can be addressed. So it's pretty awesome. I mean, pretty much I don't, other than maybe the fingers and the wrists and the toes and the feet, I've never tried any of those, but but definitely those areas. So, okay. So let's go back to some commonly asked questions. We talked a little bit about downtime, and basically I mentioned exercise, and I really encourage it. So I definitely encourage my patients to walk a minimum of a mile the next day. I want them to move. There's no stitches. 2 is I'm a huge stickler on post-operative care. This is like going and getting a knee replacement and not having physical therapy. No. You wouldn't put in the time, the effort, and undergo the surgical trauma to let it be left at that, to its own devices, because I'm sure Dr. Cavallari can attest to, if she has patients who've undergone a surgical procedure and have not gotten their physical therapy, their struggle with stiffness, pain, maybe calcification, more scarring, things of that nature. So those are things that are certainly need to be addressed in the liposuction world too. And here's the thing. I tend to look towards other countries in terms of how they practice liposuction. Countries like Colombia, which is the one I look to the most. Also Dominican Republic. What's the other? Brazil. These are countries where liposuction is so common, it's like braces. And I'm saying this because I've been told this by Colombians themselves. People just do it. It's just common. So that also means the experience level is very high of the doctors over there. But it also means that the recovery phase has been optimized based on their experiences, right? So they do things like lymphatic drainage. They do light therapy, cavitation, ultrasound, radiofrequency, mesotherapy, which is an injectable type of therapy, and a variety of other things I'm probably not listing, but those are sorts of adjuncts to the post-operative course that are indispensable. And so I won't perform my procedure without it being in conjunction with a post-operative course. And so that's another part of the recovery, but clearly it's, I think, a really important commitment to make. Other things about the recovery would just be staying limber. And like I said, just keep moving. I don't want people to stop moving, you know. You're sore from personal experience, clearly, and the first 3 days might be the most sore, but I noticed that the more stagnant I was, the more discomfort I had. And when I stayed moving and I took my walks in the neighborhood and things of that nature, I felt a lot better. So I'm sure that happens to do with more than just the physical, right? You're getting some endorphins going, you're feeling good. And that's the thing about endorphins post elective procedure. Not so high, right? Sometimes people have this kind of little bit of a regret, like, ooh, why did I do this? Because I hurt right now. I know how that is. So that's why another reason why I like people to keep moving, because mind over body, meaning if they feel good because their endorphins are going and they're walking and they know they've had this jump start now, and they start getting really excited about their future. And so change your thoughts, change your life, right? Says Wayne Dyer. Yeah. Okay. So back to recovery. So other things about doing, what am I not allowed to do? Well, you're not allowed to take aspirin a week before surgery, but I can't imagine any procedure that would say okay to that. And you're not allowed to soak yourself in a tub or jacuzzi or things of that nature while your wounds are still healing. But honestly, that takes a matter of days. And probably for most people, a week is the most that they would have to do with that. It doesn't mean you can't take showers, of course. I clearly want people to be able to be exposed to water, just not submerged in it. But in terms of exercise, when they ask me what can I and can't do, I say, what can you tolerate? I mean, I doubt anybody's going to consider doing HIIT 24 hours after their lipo procedure, right? But people have asked me if they can do things like yoga or Pilates, and I say, can you? And they both said ended up being able to do it, believe it or not. For me, when I did some personal training, I started a couple weeks after. So I did the cardio pretty much right away. But in terms of lifting, I waited a couple weeks, and it just depended on the body position I was in. If it was something uncomfortable, my trainer and I just moved me around and tried something else. So again, what can you tolerate? But I really encourage people to just keep going and keep moving. And I'd say the people who exercise have the fastest recovery rate because they have a higher pain tolerance in general, and they're willing to overcome some smaller challenges that maybe somebody who doesn't exercise doesn't know. Their expectation is to be more pain-free in their lives, believe it or not. And you can see that a lot in their recovery phase, like where expectations come from in terms of, but from lifestyle. So anyways, when patients that exercise frequently recover, they recover much quicker. And I think that also is the case when it comes to lifestyle, when it comes to, let's say, smoking, right? We can all say that skin recovery is not particularly close to the same with the skin as it would be for a non-smoker. So that's a big deal. And it's not that I won't do the procedure on a patient who smokes, but clearly when they have expectations, I'm going to be addressing them both before and after that, what they should be expecting, based on their lifestyle. Okay, so what else do we talk about with the fun sculpting? I'm trying to think a little bit. Yeah, you have a question.
Sorry, I was having a problem with my mic. Can you hear me?
Yes.
Oh, great. First of all, thank you so much. It's so incredibly interesting. I have a question. When you're talking about this, the fun sculpting, how is that, like, maybe you could explain how that's different, or if it's in your mind, more successful, less successful, how it's different than like some of these other sort of like less invasive procedures, like some of the fat freezing procedures and
yes,
other kinds of lipo. So I was just really curious about that.
Yes, thank you for asking.
I had another question.
Sure.
We had some, I think, younger folks come in here. I just wanted to know, like, what you thought about, how people, like younger kids, like how they can manage like all the body expectations and be active and all of that, so that they're, like how you kind of frame that when younger people come to see you. So those are my two questions I had for you.
Sounds great. Okay, so let's go on with the different types of lipo. Thank you for asking. I haven't talked about that in a while because sometimes my spiel changes and evolves over a course of time, but I do like to talk about when I say 5 different types of lipo. Okay, and I've performed several different of those types, and that's that. Now you'll know why I love fun sculpting the most. So as I mentioned in the earlier part of the lecture, it's the only type that will not rip, cut, tear, heat, or freeze tissue. So we can start with the classic lipo as number 1. That's the rip, cut, tear. That's just because of the amount of force it would require the doctor to perform the procedure, because again, there's no ease with which the cannula moves around in the body. So lots of tissue damage. And so the risk of skin sagging can be high, which means also areas are less likely to be considered candidates. I'm a great example. I'm 5'3", and when I was doing my consultations for liposuction back then, I was in 2013. I didn't know about these different types of lipo. So when somebody told me I needed a tummy tuck at that 111 pounds, I was like, I'm good. Because again, I didn't have a significant amount of skin sagging and I wasn't going to be losing any more weight, but I certainly wasn't comfortable with that level of invasiveness of a procedure. But it was because that doctor offered classic liposuction. So I get it now. It makes sense to me. So that's number one. Number two, let's go with the cool sculpting, my least favorite. Cool sculpting, the reason it's my least favorite is because the biggest one is the value for the money. There's literally, there's nobody who could argue with this if you actually go and ask, like, let's say a rep from the company or et cetera. There's literally no guarantee as to how much fat can be lost, so it could be 0. It could be 5. And somebody who's undergoing an expensive procedure like that is probably expecting upwards of 70 to 80% fat loss, which is what happens with surgical liposuction. Sorry, my throat got dry. Okay. So, and I've had patients come in and tell me they've spent $10,000+ on cool sculpting for multiple body areas with less than 10% fat loss. What a bummer. It's a lot of money spent for a maybe. So that's why it's my least favorite. And secondly, because holistically speaking, to kill a bunch of fat cells inside your abdomen or waistline or wherever you're putting it, and then having your body having to, clean that mess up inside, I don't know. I don't like that idea. And also the cosmetic evenness, like the risk of it being potentially uneven, because they're putting pads on, right? So it's not as if they're running up and down an area. They're literally just slapping the pads on. So what if you have the shape of the pad fat loss? That would be weird looking. So again, least favorite. Third is ultrasound. And a lot of doctors like to use that in the United States, otherwise known as Vaser. So the reason doctors like that one, that's a particularly what I say expensive technology, I mean for the doctor. The classic liposuction machine is like 5 digits. And these higher technologies are 6 digits in terms of cost for the doctor. So anyways, those doctors are typically way more into the concept of liposuction. And if you can remind me, Linda, I'll tell you a little bit about why liposuction may be different for different type of plastic surgeons in terms of like interest, if you will. Okay. But anyways, Vaser would be typically a doctor that's way more interested in offering lipo and has more extensive experience. And so they're also interested in doing more of the real etched look on the abdomen. They tend to find patients that are kind of on the leaner side so they can give them like that beautiful athletic appearance so that they can do abdominal etching, things of that nature. And supposedly the fat transfer quality is supposed to be better with ultrasound or Vaser lipo. And so that uses heat. So again, the risk there would be burns, etc., internal, external, etc. But that's that type of lipo. And then laser lipo, which I cannot remember a name or example of one, but it would be, I would say, on the similar lines to ultrasound lipo. So that was, you also use heat in terms of helping to melt away fat cells as the cannula is being moved around, supposedly making it easier for the doctor. I've never found it to be that much easier, but that's because I got spoiled with with the technology I had gotten pretty early on. So the fifth one would be fun sculpting, and how it's different is it uses vibration and oscillation, and it does not change at all in temperature. It doesn't use heat or cool. And I call it like using a sewing machine. It just is so gentle in terms of how it moves my hand through the tissue that literally if somebody were to shut the vibration off, it would stop me in my tracks. So that's how lovely it is in terms of working with. And for the person who is comfortable watching surgical type procedures, I probably have some examples in my older parts of my social media, but it shows you how little pressure it requires for me to do it, which also means I can do it without using general anesthesia, which is great. I mean, not everybody is comfortable with undergoing general anesthesia. And we basically just use oral medications that help people relax, but their actual procedure is done under local anesthesia. And so because they're completely numb, they're just hanging out, you know, they're like, yeah, what's up? How are you? Sometimes we have chats and conversations in the operating room. That's why it's called bun sculpting. It's actually pretty fun. Some people have literally told me it feels like a massage. I was like, oh, please. I'm lipoing you right now. Is this a massage? Yeah, it's awesome. That's pretty exciting. So then you had a second question about young people. Okay. I guess it depends on how young you mean. Certainly, I have taken care of some people in their early 20s and whatnot. Great question. I'm a huge advocate of people staying active physically, and so I've read in a lot of books, to be honest, that an obese active person has much better health than a thin inactive person. So size may not necessarily be everything, right? But I'm not necessarily the huge proponent of body love to the extreme of where you're excusing excusing what it means to have significant amount of or excessive amount of fat, because it has an impact no matter what. It does have an impact, and I still want people to be comfortable and happy with themselves, but to be honest, that'll start within, not without. And what happens without will reflect that. So that's, again, I'm really big into focusing on your well-being, and that's why I do a lot of personal development in my consultations, but also I do a lot of personal development posts in my social media, because I truly believe my life has changed in so many ways because I went through a lot of things, some traumatic, some that involve suffering, but it led me to an evolution and to the place that I am now. It's exactly where I needed to be in order for me to be where I am now. And I'm the most proud I ever have been of my body and the way it looks. But it's not because, I guess it's because of how I feel inside. I don't think I would have had the same regard of what I look like now, at 48, by the way. Yeah, can you tell? Can you tell? Anyways, I don't think I would have had the same regard if I hadn't been through what I'd been through. So I'd learned a lot about how my perception, and I say this type of procedure is not about vanity to me. It's more about perception. And once I started changing my inner world, my outer world just evolved with it. So I actually, at 48, look younger than I did at like 35, 36. You could see pictures, and I've probably posted a couple someplace, but it's amazing. I really do look way younger than I did when I was in my 30s because I was going through something, right? So if somebody in their 20s were to come to me, the first thing I would probably find myself talking to them about would be how they feel about life in general and what they're going through emotionally, because I've actually been approached by parents who've wanted their children with body dysmorphia and eating disorders to be treated. And I'm like, this isn't the answer. I feel like that would be enabling the problem. So, but then what I've done in exchange was invited them to come be my patient, almost like a primary care, I guess. I don't know if there's a word for it, or like a life coach. So I've actually taken care of patients like that, where they came in their young years, maybe in their late teens. And one of my experiences with one of them was to do some inner work with her there, talk about like energy and love and vibration and sound healing. And then we went on a hike, and that's when her ideas started flowing because her endorphin levels were going up. So we climbed a mountain, a really famous mountain here in Phoenix, Arizona, called Camelback. And then as we're coming down, I could just see like her shift in her perception, right, quickly. And all of this can happen in a quantum moment because we don't live in a world of Newtonian physics. We live in a world of quantum physics, which means you can have life-changing experiences in instances, in moments. And I know that from personal experience, and maybe some of you do too. So I think that's what happened for her. And by the time we came back down, it was like she had a totally different concept or perception of what her future was going to be like. How cool is that? So again, yeah, I'm all about, I love it. You know, I love making people pretty and I love making people handsome and feel proud of their bodies. But the bottom line is if that's their only intention, I'll usually be able to figure that out in consultation. And those are not my patients. Those are not my patients. My patients are the ones who want to grow in many, many ways. And it's not uncommon that I'll whip out a book called Metaphysical Anatomy, and it connects their body to their mind. And so that whatever chronic disease they might be experiencing, it connects that to life experiences they may have. And it's amazing how many times it resonates with those people. And I say, this is part of why you're here, by the way. You're not just here to meet me about lipo. You're here to meet me about seeing life in a different way. So I hope I explained some things, and I hope if there's any other questions, I'd be happy to answer. Cool.
How you doing? So
Hi.
I like that you brought up the quantum physics because that's actually was just released. That an MRI machine showed quantum have you heard of a quantum entanglement?
Yes.
Yeah. So yeah, an MRI actually may have found there. So physicists. This is November 30th, 2022. It says using modified MRI machines, physicists may have found quantum entanglement between the heart and brain.
Oh, absolutely.
Oculus.
That's
Absolutely.
insane. Like, I know there's been like studies for a while about our brain being like a quantum computer and having a comparison to it, but I mean I've studied like quantum entanglement, quantum teleportation for a while now. So to see that we're related to that in any single way
coming up
is
on time.
insane. Because the science that can be involved in that, oh my God.
I could talk about this for hours.
Oh, me too. Literally, a whole day.
I remember a study where they had, and they talked about the heart. The heart sees before the brain, by the way. And so that's why they always, in ancient times, talk about leading with your heart, because they did a study where they were showing images, and the images were purposefully to give strong emotional reaction, positive or negative, right? And it came to the point where in the study, the vital signs of the patient would change prior to the image coming up.
Wow.
The heart was
perceiving insane.
Prior to the brain and the eyes. It's beautiful, huh? So, and then I also just wanted to share another thing about, we were talking about quantum entanglement. So I believe in the realities, like the multiple realities. I don't know if anybody's ever seen Interstellar with Matthew McConaughey, but you know how he's kind of in that digital library of quantum realities kind of thing? Mm-hmm. I feel like that's what we're literally living. We just don't see the digital library, and every choice we make shifts us into a new reality in an instant. That's what I meant by the instant change, literally because of the choice we made. And so I've now can literally identify some of those moments. One time I was talking to I shouldn't say one time, more than once. My life coach will say things and they'll just hit me like, and so one of the things he said to me was, gratitude is your greatest weapon, Bilge. And I was like, and it hit me like that. Like, you know how in a movie where it's like, boom, like that focus. That's what it felt like. It like suddenly like the world had like focused on me and boom. So now I realize that is when the quantum shift, that's like when I shifted from one reality to a different one, because something was said to me that had such a profound impact that the choices I made from there on out will be because of those words. So,
That's awesome.
And lipo. So, thank you guys. I mean, Yes, I love Vital Connection MD. And again, I'm not just about the lipo. I would love to come back and talk more about things outside of lipo, but I love the lipo because again, your perception is everything. Your perception is your reality. So clearly I want to empower people in terms of how they feel inside and out.
All right, so I was going to come up here just so that way I could kind of encourage more people. If they have any questions, it's okay. We got a couple in the chat. But thank you so much for all that information. I had no idea
Thank you.
literally any of that information. And one of the questions that was asked, are there different levels to the procedures you can get, or are they all kind of in their own separate thing? There's no kind of like entry level kind of lipo, or maybe there's a larger procedure if people want to get an extensive amount removed. Like, what are those levels of the procedures that are out
Oh,
there?
I see what you mean. Well, I consider when a patient may come in for consultation, we talk about areas, and an area is my hands wide open, okay, and that's just the amount of time it might take me to take care of an area, which is typically 60 to 90 minutes or so, right? So typically, let's say a patient wanted to be treating their torso area. Their abdomen is always two areas because the upper and the lower abdomen is, to me, two areas. And then the love handles would be an area. The bra line would be an area. And in terms of levels of intervention, I typically don't do more than about 4 areas in a surgery. And I also don't do more than 1 surgery a day. I left the emergency department after 20 years and burnout, and I open the doors to a facility with this skill set and with 0 patients. And it was because of life-changing events that happened prior to that led me to do this, to choose that. So I've decided that it feels so much more amazing to be able to just take care of one patient and make them feel exclusive and special and give them my 100%. So that's why in that meantime, I'm not in a rush, and I'm not going to tell you I can get this done in 2 hours. I get it done when I get it done, which means that's why I kind of limit to 4 areas or so, because there is a limitation to the amount of lidocaine numbing medicine I can use. And I want to be able to optimize that and take off as much of the excess fat as I can in order to make that treatment. And some patients maybe who are on the larger side, I might say, hey, let's do 2 areas today and 2 areas tomorrow, because again, now they've had 24 hours to metabolize that numbing medicine. But we can do it that way, and that also gives me the opportunity to treat larger areas but take more fat off of those larger areas and really optimize that. And it doesn't change the price for them, so they're all in. So that's kind of like what you would consider levels. It just means areas that you might consider. And a lot of patients might do this. They might do, let's say, their abdomen and love handles, and then they decide, I really like my results. This is really cool. They might want to do one of 2 things. They might say, I want more fat off, touch those areas up. Or they might say, you know what? Now I want you to do my arms and my inner thighs. Come back. Let's do that. They got encouraged. They really like the changes. People do that a lot. People find reasons to come back to me. And it's usually like, okay, let's do some more etching. Oh, wait, no. Okay. What else do you got? Let's try something else. I also do skin tightening with a J plasma technology called Renuvion. So that's something we can talk about in a different lecture, but it's really nice adjunct to liposuction because it doesn't add to the downtime or the scarring or any of those things. It's just an extra bonus of skin tightening. So
Awesome. Thank you so much. We got one more question in the chat, if you don't mind answering. So,
Sure.
it's kind of a funny question, but a lot of doctors have a favorite procedure they like to perform, something that they're either really skilled at or it's something that they enjoy. Is there something specific, one, if you would, of all the procedures that you perform, one that's your favorite or one you enjoy or your least tedious or laborious of procedures that you perform?
I would say basically she's asking me what my ideal patient would be too, or he, but definitely fun. I mean, this particular lipo is for sure my favorite. I do offer, like I said, the skin tightening. I do injectables. I do hormone therapy for men. I do IV therapy and a variety of other things. But definitely this is my favorite. And my ideal patient would be somebody who was on the leaner side, who just wanted me to, get rid of some small problem areas and then help them with high definition abdominal etching. That's my favorite. And maybe a fat transfer to their butt or something where I can create some curves. So I'm defining their abdomen muscles with etching, which means I call it the superhero body. So they have the vertical lines in their rectus muscles being enhanced, and then their love handles are extracted. So now they have the beautiful hourglass because I did a fat transfer into their hip dip area and also into their butt. So now they just have that. That would be my favorite. When I'm watching, I'm like, ooh, oh yeah, let's keep going. It's kind of funny. I talk to myself and the patient kind of says, like, what's going on? And I'm like, no, this is good. This is good. This is good. Just lay there. I got this. So yeah, that would be my favorite.
That's very awesome. So we have a few minutes left. If anybody else has any questions in the chat, feel free to ask them. We've got Dr. Gregory here answering all of your questions, whether it's about lipo or fun sculpting or any of those procedures.
Personal development for sure.
Yeah. So one more question from the chat we do have. So it's difficult for pretty much anyone to kind of in one consultation understand if someone has any certain mental health issues or if they are coming to you for the wrong reasons. Do you find it when maybe after so many visits you start to think that, or maybe you start to realize that maybe there is something deeper that's going on and you have to refer them to a medical professional for, deeper understanding of maybe their own, I don't know what the medical term would be for that, but the question is, how do you deal with those types of situations where you start to discover they're becoming either addicted to the procedures or they're coming to you for reasons other than just kind of, tidying up areas where they want to improve?
I'd say it's not common. I typically, let's just put it, an instinctual person, and I trust my instincts very much so. So I'm usually identifying them before they are getting a single procedure with me. I'll know. And I have a really strong connection with my staff who are very much into personal development and intuition. We call it energy, right? What is that energy bringing? That patient's energy. What are they bringing in? Is it a low vibration? And if I feel like when I first started, perhaps I might have said yes to that type of patient, and it put me in a really bad position. So now I realize pretty quickly, you can tell. I mean, they'll say some buzzwords. It means you can't interrupt. It's really hard when you're having a conversation with people because a lot of people just are working on their response and not really listening. And trust me, I'm not saying I'm not guilty. I'm very guilty, but I'm really working on really listening because they'll say some buzzwords and I'll know. I'll be like, that person's intentions are not in alignment with this place. And so I might not necessarily directly address it in that way because some people's ego might not be able to appreciate. They may get defensive. And so I might find different ways by saying, I don't think you're a great candidate, or that's just really not, I'm going to meet your expectations, things of that nature. That's probably what I would say most likely. And then for anybody who already has been with me and they may be trying to go in that direction, I'll call them out. Call people out, call them out. And I'll say, hey, I'm not saying words like addicted. I'll say, I don't think this is the issue at this point. I think you've had a tremendous transformation. Here's your before and afters. I really like what you have. And I said, it's about expectations at this point. And then if it really sounded like it had something to do with more the mind rather than the body, I'll call them out. And I'm not necessarily asking somebody to go see a psychiatrist. I'll say, hey, you're really dealing with a lot of pain right now. It's more about calling them out by seeing them with your heart, right? I understand. I have compassion. I've been there. We've all been in a place of struggle and victimization and suffering. So I'll call them out in that way by seeing them. People want to be seen and heard. Wow, so I'm here for that.
That's really powerful. And I honestly didn't expect that to be the answer, that you're very honest with your potential patients or your current patients, and you're having these conversations and your entire staff is involved. That's incredible. So congrats to you, and definitely some confetti out there in the audience for that's just incredible. So anything you want to leave us with, if it's whether how to find you or what you're doing in the metaverse, and we'll definitely have to check out your new world now. We'll pop a portal open for the live stream and give them a sneak peek. But please share with us where they can find you.
So you can find me, my best work is on Instagram, vital_connection_MD. In terms of how much focus commitment I've put into Instagram, that's why that would be the best example. You'll see lots of before and afters, but then you'll also see videos I post called Dr. Gregory's Meta Moments. So it's me just talking about just the things we've just been talking about. And then I also do something called DoorDash consultation, because a lot of times people cannot make it into the clinic or make the time to take out of work to do a consultation with me one-on-one, and that's fine. But they still want to know, they want to learn more. So maybe it's going to take them a little longer to introduce themselves or pull the trigger by coming to visit me. But certainly they're going to learn some things with my DoorDash consultation. So it kind of make it like an FAQ where I answer one simple question in a minute or two. I might talk about downtime. I might talk about a fat transfer or things of that nature. So quick things like that. So Instagram is my best. I'm working on my TikTok, so I'm just going to leave it at that. VCMDAZ is my TikTok. And then my website is vitalconnectionmd.com. So I really appreciate you guys. Thank you so much. And I do plan to come back for a variety of reasons, clearly to talk more about lipo, but I'm always interested in talking more about mind-body healing and just how we can be the change. Honestly, that's my intention, is to empower people to the point where they can be the change, because it's infectious. And if I can, it's kind of like how word of mouth is when you get new clients or patients, right? One person tells two people tell four, et cetera, et cetera. You can do that with well-being. You can do that with energy and vibration, and it can change in an instant. So thank you, everybody. Appreciate you.
Amazing. Thank you so much, Dr. Gregory. Thank you to everybody in the audience. And of course, thank you to everybody in the live stream chat. We really appreciate you joining us, but we're not done yet. We're going to hop to the new world, which is Vital Connection. And you can check out Dr. Gregory on social media, Instagram, TikTok. And of course, we're about to go there now to her new world. So follow us, and then we'll get a sneak peek, and we'll end it from there. So let's pop open that portal.
You gonna come, Zach?
So as mentioned in HouseCall VR Auditorium, you can find Dr. Gregory on Facebook, on TikTok, and of course on Twitter. And looks like we've got a live Q&A Monday, 7 p.m. Central Time. Make sure you come back and check it out. Let's go ahead and wander around. Let's check out this incredible world.
I wish you could really serve cocktails.
Here is a glass of champagne for you, my dear. Where are you? Here you go. Glass of champagne for you.
Wait, where'd it go?
Wait, where'd it go? Here. There you go. I'll get this one over
It's
here.
floating.
Yay! Cheers!
Oh, here we go.
Cheers! Clink,
Cheers!
clink, clink, clink. Yay! You did great.
I'm wasted.
Woohoo! I'm gonna go in the pool with my champagne. Come on, let's go.
Oh, that's...
Did you jump in?
Oh, snap.
back. Listen, after the last update, all of a sudden, I don't
All right,
know
y'all. Thank y'all so much for joining us today in HouseCall VR in the auditorium, presenting Dr. Gregory. Make sure that you like, make sure that you follow, and of course, keep leaving those comments. Continue the conversation down in the chat. We'll be back with more live streams with HouseCall VR, more guests, and of course, more new world presentations. So thank y'all for watching. I'm Oculus 410. This has been another HouseCall VR presentation, and we'll see y'all next time. Bye.
And then, like, I was at like 99% geo.
There's a huge, like, we were all talking about it in the Discord. Something's crazy going on with the geo right now.